Okay, hello team. Got my message here. We will meet online this Thursday at the usual time of 8:30, and this will be our last meeting for this year, and we will return to our online meeting on January the 2nd, 2025. So the office is going to be closed this year on December the 13th. 2024, the office will be closed. That would include me, Pat, Head, and Janet. We're going to take some time, much needed time off to rest and to spend time with our family and friends. So we will not be available to answer questions or answer calls. We will be back at work on January the 2nd, 2025. So we will answer all calls when we return. However, with our AP being over as of yesterday, there are still some customers that we have to attend to. So I'm going to just read an email that I received from one of our companies. A lot of our companies has given us a lot of valuable information, and all of these companies, they did a great job explaining what we can do. Now, let me go and find one of those. I think I have one here from Saunders that just tell everything. Hope I can find that real quick. Okay, here it is. So I'm just going to read it. We also want to take this opportunity to remind everyone that there will be 2 important SEPs available to use after AEP ends. We know that there are some customers that we still have to take care of before the end of December 31st. I know I have about 10 that I'll be taking care of tomorrow and Tuesday. And they'll still fit in because of these SEPs. The first SEP is none. The SEP is none will be available to anyone who is losing their plan for 2025. All of those people in Humana and Aetna that got those letters saying that their plan was going to end. And with this large number of plans that exiting Georgia, we can continue to submit applications through 12/31/24 for a 1/1/25 date. Effective date on anyone who existing plan is not renewed. Okay, this will ensure that they'll have one of the MAPD plans on 1/1/25 versus if they don't do anything, they will revert back to original Medicare with Part A and B only, and they won't even have a prescription plan. So be aware that there might be some people that don't have a prescription plan for a whole month if we don't get them in this plan. So we're still working hard on that. Another step is DST will also be available in all Georgia counties with the following beneficial qualifications. Must be sure that your client meets these requirements before submitting an application using an election code. Now, you can't take Humana's election code and use it on Saunders. You will have to know which company and what election code that they want you to use. Call the company if you do not see it in email. Call the company and ask them what is the election code for them. Some might have DST, some might have disaster, have different things, but you have to use the proper election code for the different companies. First of all, they have to reside at the start of the SEP eligibility period described in an area for which a federal, state, or local government entity has declared an emergency or major disaster, or does not reside in an affected area but relied on help making healthcare decisions from one or more individuals who resided in an affected area, and also was eligible for another election period at the time of SEP eligibility period, and did not make an election during the AEP. Now, if they made an election during the AEP, they cannot turn around and use the SEP code. Okay, determine if an individual is eligible for this SEP. The MA plan must first attempt to obtain proof that the individual resided in an effective county, driver's license, utility bill, whatever. And if the individual is unable to provide such proof, the sponsor must accept the application attestation that he or she resided in an affected area. All SEP, DST, I know this is a code that I think Humana used, but do not go and use this code because Gail said she think Humana used this code. Make sure. All SEP disaster application will be monitored and verified. Any application found to be submitted that do not meet the above requirement will be rejected and tracked. Also, starting January, we know we have the OEP that's coming up. So you can't, there are rules around that, so you have to be careful about that. Now let me go back to my original messages, see if I can find myself. Like I say, although AEP was over yesterday, there are still some customers that we have to attend. I'm going to just, like I said, I read the email. Okay, as far as health insurance, ACA ends December the 15th for effective date of 1/1/25. Anything written from December the 16th to January the 15th, 2025 is for effective date of February 2025. And I want to take this time to thank every one of you for all your hard work, taking care of our existing customers and also helping others. Most of us spent most of our time just taking care of our existing customers, and we were able to add a few, but that's what it is. We are agents with a service heart. So again, on the in conclusion, if you're planning to attend Fresh Start 2025, two things I need. Register immediately. If you are not planning to attend, please let us know. We have a lot of preparation and planning and budgeting to do for this event. So if you are not planning to attend, please send an email to Janet at geloffice3@gmail.com so that we can more accurately plan for our target audience. Again, thank you, and I will see you online on, no, I'm going to get the date wrong because I'm not looking at the calendar, but I think it's December the 12th. All right, see you then.